Another type of pain I would like to say is that I just talked to you the pain relief. One is the paracetamol and non-steroid anti-inflammatory drugs. And the second step is if the person is not getting relieved, so therefore then you can use the light opiates like tramadol, etc. And 50 milligram in adults it can be used by oral tablets, or it can be given intravenous infusion also. And finally, if the patient is still not getting relief, you can give strong, what we call that, opioids like dimorphine and morphine. So this will relieve the pain. The morphine can be given oral route also, or the subcutaneous route also, and intravenous route also. You have to, balance and graduate these quantity of medicines. The patient himself can qualify to administer these kind of drugs to himself. But what I mean to say is these strong opiates should reserve only for those people who are in the terminal state of their life, like they have got pain from the cancer. So therefore, they have. You cannot say they cannot become addicted, because addiction means a psychological dependence, whereas addiction is psychological, whereas dependence is a physiological necessity. So therefore, you can say every 4 hours you can give dimorphine or morphine in a liquid form or something like that. And suppose somebody has got other problem like disc prolapse, you can give epidural block also. You can have epidural anesthesia. You can give subcutaneous through the subcutaneous route also. You can give an infusion of these drugs like morphine, I have told you. And there are other techniques in which, sometimes cordotomy had to be done. The anterolateral part of the spinothalamic tract has to be divided to cut down this pain pathway. And if there's a local lesion like metastasis, pain due to local metastatic lesion, so you can push in, local anesthetics to cut down the pain. And intrathecal, we have already told you, like spinal anesthesia is quite useful in surgery, in gynae practice, the pelvic surgery, lower limb surgery, and this also helps in taking care of the perioperative pain. So pain relief, I'll basically tell you, number one, you have to treat the cause. If a person has got infection, you have to treat the infection. The non-steroid anti-inflammatory drugs and the strong opiates will not be useful till the time you eliminate the cause of infection. You find out what is the cause of pain, if it is a cancer pain, pancreatic, or gastric pain. So therefore, you have to inject near the celiac ganglion the alcohol or phenol, whatever it is, so that patient has a comfortable life. And that's all I wanted to speak to you. Thank you very much. I hope you may find my little talk quite useful, but I request you to go through the books, and thank you very much. I'm grateful that you have been giving a very good response. And next time I'm going to talk to you shortly, and I think I might talk about orthopedics. In orthopedics, what is more important is anatomy of the bone, the fractures, osteomyelitis, bone tumors, dislocations. So which will suffice for your this thing. You will just introduce to it. Then I wanted to cover, somebody has told me, yes, of course, hydronephrosis and neurologists, benign prostatic hyperplasia and things like that. I'll be coming back to you shortly. Thank you very much. God bless us all, and be kindly, be happy, and keep your mind at rest. Keep yourself away from all extraneous things which we are listening. That is the drugs and something like that. Be very watchful and careful about your colleagues and friends whose behavior is changing. All right. It's very alarming in many places. Thank you very much.